As we know, the rule has a lot of complexities, and so trying to pull in all of the information that's required for that machine-readable file, whether it be the charge master, all of the patient claim detail to come up with those patient estimates, and then also all of the managed care contracts. Pulling all that together, putting all of that information into one place really led to a lot of complexity for hospitals to try to comply. And truly at a time where a lot of hospitals were short-staffed, so they didn't have the resources to kind of put that information together. That probably contributed to a good bit of the slow growth in terms of having hospitals be able to comply fully with the rule.
I think what's also been interesting is you know, there's two different levels to this. There's the federal and then the state level. And so what we've seen is like the states are starting to also create some new mandates or specifics around, you know, what you're allowed to pursue in terms of if the patient feels like the prices weren't transparent. So for example, in the state of Colorado, they've recently passed some legislation that allows, you know, or protects the patient from those large bills if they feel the price transparency mandates weren't adhered to.
With Experian and Cleverley Associates, we collect a lot of that data that's required for the machine-readable file and the patient estimation tool. And so we became kind of a natural resource for hospitals around the country to say, hey, you've got this information. You know, instead of us using our internal resources to put this together, can we work with these two organizations to try and do that? And so that was a huge value add since we have that information together and sort of that technical capacity to understand here's the format that we think is useful, that also complies with all the rules, sort of relieves that anxiety around if we put this information out there, is CMS going to view this as compliant? So they know that they're working with trusted partners that have had those conversations with CMS, that have released these files and have been through the audit review process.
You know, as Experian Health kind of took on and reviewed the price transparency rule and really dug in on, okay, how are we going to solve this for our clients and partners? You know, we obviously identified the two key components. One was, okay, we need to provide you know, a patient-facing, friendly sort of estimate-creating solution that shows those top 300 shoppable services for a hospital or doctor's office. And so we were able to do that through our existing product, self-service patient estimates. And so we have this portal that we can integrate with our clients' websites. They're able to go on, and patients are able to walk through a user experience that guides them through that process and to see those details. What we did not have, and where Cleverley came in, was those complex machine-readable files. And so, you know, Cleverley's been just a fantastic partner from the start in terms of educating us, bringing us up to speed on all the work that they've done to build this integration with their clients and partners. And so we were able to come in with both sides of the price transparency rule and say, okay, now we solve both. And we're here to provide a holistic solution that delivers that value. And again, to Jaime's credit and their team's credit, it's basically taking that non-standardized back of napkin to compliant readable file across the board. So yeah, I'd say solving those two challenges have been the ultimate goal of this, and I'm happy to say that we're succeeding in that front. So.